Welcome to your pre-operative liposuction educational video. My name is Mallory Nolan. I'm one of the nurse practitioners here at Hagopian Plastic Surgery. This video is intended for patients of Hagopian Plastic Surgery only. It's not intended for the general public. You may glean something from this, learn something if you're a patient of another practice, but again, this is intended for our patients only. This video is going to help get you ready for your surgery. It's also going to help answer some questions in advance of your pre-op appointment. Please know that you can ask questions at your appointment. This is not the only pre-op you'll have. A little bit about me. I have been working with Dr. Hagopian at Hagopian Plastic Surgery for almost 2 years now, and I am a dual certified family nurse practitioner and adult gerontology acute care nurse practitioner. What is liposuction? Liposuction, or lipo, is the surgical evacuation of fat. This can be done for a couple different reasons. Sometimes it's done to achieve an aesthetic goal. Other times it is done for medical reasons like removing lipedema tissue. This is the majority of our patient population right now are treated for lipedema, so you'll be hearing a lot about lipedema. If that's not you, you can just kind of sit back, maybe learn a little bit when I talk about those sections. So Dr. Hagopian performs a couple different kinds of liposuction. The main thing is that he does power-assisted liposuction. He uses something called tumescence, which is a fluid that both numbs and helps prevent bleeding. And that goes in before lipo is performed. The next step of lipo is breaking up the fat, then it is sucked out, and then there is a smoothing phase. This is all done with something called a cannula, which is a long metal stick, basically. There's also vasor liposuction. Dr. Hagopian performs that as well. It can be done in the office and then at a couple different surgery centers that we go to. So that's kind of what is lipo. Here are some general things about liposuction performed at our practice. It can be done in the office. A lot of our lipo is done in a surgery center. If you are going to surgery for liposuction, you will be put to sleep completely with general anesthesia. This means that you will not remember any of it and you will be basically asleep. It's not actually sleeping, but you are not going to be aware of anything that's going on. A machine will be breathing for you. When we perform liposuction, Dr. Hagopian has to make pilot holes. These are about the size of your fingernail, and they are where he uses the cannula. So he uses the same hole to use the tumescence to break up the fat and suck out the fat. The amount of lipo holes you have will be dependent on how many areas we're trying to reach. Every surgery is different, every patient is unique, but for a lot of our patients, we leave these holes open. So they are left open so that they can freely leak so that you don't develop seromas or fluid collections. This is something we'll talk about a little bit later as well. Some patients, for very small areas of liposuction or small amounts of liposuction, we will close the lipo incisions with a dissolvable suture. Other times the suture will be placed because it's a lipo incision that doesn't like to heal well. So this could be on the lower back or mid back. So it just kind of helps that incision heal a little bit better. So please let us know if you have any questions about will your lipo holes be left open, why are they left open, but the general rule of thumb is that it's better out than in when it comes to the fluids. I'm going to briefly go over some of the risks of liposuction. This is not all-inclusive, but this is a pretty comprehensive list of the risks. Anytime your skin is cut for surgery, we risk infection. This can happen for a variety of reasons, and there's a lot of heavy lifting done by you on preventing infection. What does infection look like? One area of one side of your body will get new blossoming redness, heat, or tenderness. It's one-sided because if you have redness on both sides, it's probably just a deep bruise. But this new redness is kind of the way that I describe infection to our patients. The way that we prevent it is kind of multifactorial. So there's lots of stuff done in the operating room by the OR team to keep you clean. You will be doing some stuff before and after surgery. We'll talk about that later. That includes Hibiclens and your antibiotic by mouth. But even if you do everything right, you can still get an infection. This is more common with ultra high volume liposuction, which is often the type of liposuction that we perform for lipedema relief. Anytime that you go to sleep for surgery, we risk blood clot. This also comes with being a little more sedentary than usual. A blood clot usually starts as a deep vein thromboembolism. What that means is that it's a blood clot, but it's distal. It's usually in the calf or far away from the heart. When a blood clot becomes a problem is when it travels. Obviously, we don't want anyone to have a blood clot, but a DVT, or deep vein thromboembolism, is a lot better than when it travels. When it travels, it can go to the lungs or the heart. When it goes to the lungs, it's called a pulmonary embolism. That would cause shortness of breath, chest pain, and all sorts of upper respiratory kind of symptoms. You just feel really depressed on your chest. So all this is to say, we have that risk no matter what surgery we're doing if you're going to be put to sleep. The way for you to prevent a DVT or PE or any kind of blood clot is to get up and walk around every 2 hours for 5 minutes while you are awake. This does not need to be distance. I don't need you to go far. You can walk in place. This is especially important if you are going on a plane or if you are having a long travel day home for our out-of-state folks. So all this is to say, set a timer on your phone while you're awake. We move around enough in our sleep that you don't need to set a timer to do that while you are asleep at night. There are people who need chemoprophylaxis or blood thinners that they're going to take right after surgery. This is dependent on a lot of different risk factors like age, comorbidities, BMI, prior PEs, DVTs, anything like that. So your individual risk will be calculated at your pre-op, if not at your consult. So not everybody needs a blood thinner. We always have to weigh the risks of a blood thinner, which is bleeding too much or anemia, with the benefits of a blood thinner, which is preventing blood clots in our higher risk patients. Now I'm going to move on to some of the risks that are more specific to liposuction. The most common ones are fluid collections. We talked about those a little earlier, seromas and hematomas. So a seroma is just fluid that comes from your body in response to inflammation. And this can happen when you don't wear tight enough compression, you don't wear it for long enough, or it can just kind of pop up spontaneously. What it looks like or feels like is a water balloon under the skin. So it's going to be this it really might even have a fluid wave, like a ripple, might even have like a funny sound to it. Hematomas are blood collections. They are hard. They look like a little bruise or a big bruise under the skin, and they show themselves on the skin. Seromas don't really have skin changes like redness or anything. So both of those are not an emergency. Seromas, more than anything, are a little bit frustrating. Hematomas, they can grow, and they can become an emergency if they get really big, but that's highly unlikely with liposuction. So how do you prevent these? I talked about with the seroma that you need to wear your compression 22 hours a day for 6 weeks. You need to wear compression that is too tight for you before surgery. So I'll talk a little more about compression later, but that is why we are so strict on the compression use after surgery. Hematoma prevention is largely related to your exercise after surgery. So you cannot exercise for 3 weeks post-op. No intercourse, nothing that gets your heart rate or blood pressure elevated. This is because the tiny capillaries that have been injured in surgery need time to heal. And if you don't give them time to heal and you just go and start, exercising, jumping around, all that stuff, it can cause a hematoma. So those are specific to lipo and the most common things we see.
This is Dr. Hagopian here. I'm just busting into Mallory's video. I wanted to talk to you briefly about a couple more risks of liposuction, particularly if you're getting ultra high volume liposuction or if you're using Vaser. So Vaser is ultrasonic liposuction, where we basically, before we infuse the fat with the tumescent fluid and then we go in with an ultrasonic probe, it uses energy to break apart all of the fat before liposuction. We do this mostly for cosmetic reasons. Sometimes we do it on lipedema patients, but either way, the Vaser has a set of specific risks if you're using this device. This device is incredibly powerful. It is a good device. It is an energy device, and anytime you apply energy into the tissues of the human body, you risk burns. Burns from a Vaser are rare, but they do happen. If you have a Vaser burn, what you'll notice is your skin will start to peel and a burn will develop over a couple days after the surgery. We'll know it in our follow-up, and then we'll be able to manage it appropriately, but that is something that is possible after using a Vaser. Again, rare complication, but possible. Other complications with liposuction depend on the area with which we're liposuctioning. And these are not to scare you. They're not to dissuade you from doing the surgery, but there are things that you need to know can happen before surgery so you can make the best decision for yourself. There's a very rare complication when you injure a nerve in the arm. There's a particular nerve that's very close to the elbow. It's called the ulnar nerve. It allows you to make a fist. It's a very important nerve for the use of your hand. It lies in the medial epicondyle, your elbow, right there. It's your funny bone. You hit it on the table and it makes it little, ooh, that doesn't feel good. Well, hitting it with the liposuction cannula is even worse, and sometimes you can injure that nerve. So that injury can happen. In order to prevent that, we do a couple things. We stay away from that part of your elbow during liposuction to the arm. What that means is you might have a little bump on the inside of your elbow where the fat was not suctioned. I generally accept that a little bit of a contour irregularity or a contour risk as to not risk injury to that nerve. Additionally, there's injury to any deeper structure no matter where you are on the body. So if you're lipoing the leg, there is always a chance you injure a great vessel of the leg. If you're lipoing the abdomen in particular, if you have a hernia that goes unrecognized, or you sometimes just in the general course of liposuction, you can injure the deeper structures, the lung, the liver, the kidneys, the spleen, or into the mediastinum, which is where the heart lives. Now, I've never had these complications happen to me as of the time of this recording, but I have seen good plastic surgeons injure the liver, the lungs, get into the bowel from an unrecognized hernia. That's a risk called injury to deeper structures, and that can happen anytime you do liposuction on the trunk of the body. The risk of that is low. If you have a mass or you think you might have a hernia, not a hiatal hernia, but any other kind of hernia, make sure you point that out to us and mention it to us on both the preoperative visit and the day of surgery period. We will examine you on the day of surgery to see if we can feel a hernia. If we suspect you have a hernia, we will not perform liposuction of that area to avoid risking injuring these structures. If we do injure these structures and we know it immediately on the table and we're at the hospital, I'll call a general surgeon in and we will attempt to repair these things in the operating room. Perhaps the biggest risk to liposuction too, the most common complication after liposuction, is something called a contour irregularity. What a contour irregularity is basically anytime the skin is not smooth after liposuction. You can get a dent, a divot, any kind of abnormal shape to your skin afterwards. This happens pretty commonly. It just kind of depends on your skin quality, how much extra skin you have. It happens a lot more with ultra high volume liposuction in patients that have excess skin. The best way to prevent this, we do a technique called safe liposuction, which is kind of how I like to try to prevent this. But anytime you perform liposuction, there's always some kind of residual effects on the skin from liposuction. And any before and after you look at, you'll see sometimes a cobblestone appearance, sometimes you'll see a dent, a divot here and there. And that's pretty normal after liposuction. It's almost impossible to get a perfectly smooth result unless you start out pretty much perfectly smooth. Sometimes you can, and patients that are getting small volume liposuction with really good quality skin can end up with a really smooth end result. But many times there's some small imperfections in the skin that you'll notice after liposuction, particularly after 3 to 6 months when the swelling finally goes down out of the areas we liposuctioned.
Now I'm going to touch on some of the more side effects of liposuction. You can also call them risks, but these are just expectations. Asymmetry is one of the big ones. We are all asymmetrical as we walk around today. Side to side, our arms and legs might be different sizes. This is pretty common. This will be true before and after liposuction. You also heal differently from right to left. So you have to give your body the appropriate amount of time to heal before you start to really look and scrutinize asymmetry or symmetry. You can have contour irregularities. So if you already have a surface that is lumpy and bumpy, liposuction is not likely to make that better. It can actually make it look worse. Dr. Hagopian takes time to smooth after he has evacuated the fat when he's doing lipo, but it is important to keep in mind that if you're looking for that tightest, smoothest contour to the skin, that is more associated with skin removal, not liposuction. So contour irregularities, that's one of those cosmetic side effects. Numbness and tingling is very common after liposuction. Uncommonly, it can become permanent. You'll probably have some patchy numbness that goes away over 3 months or so. And then swelling or lymphedema. This is very common in the acute post-op phase. So a lot of people have swelling from 7 to 14 days post-op that dissipates gently over the next 3 months post-op. Occasionally, this lymphedema or swelling can be permanent. Again, like I talked about with lipoburn, this is more common in people who already have lymphedema present before we lipo them, as well as higher BMI and later stages. Things you can do to prevent lymphedema is wear your tight compression all the time, do MLD early, and elevate your feet when possible. If we operated on the legs, elevate your arms when you are able to, if we operated on the arms. So that's a little bit about some of the side effects. Some can be temporary, and in rare cases, they can be permanent. Chronic pain is also uncommon, but it's not unheard of with liposuction. We will manage you post-operatively for pain, but if this gets to a point where 3, 4, 5 months post-op, we will recommend that you talk to your primary care about a referral to a pain specialist, because at that point you do become a chronic pain patient if you're still needing pain medicine over 3 months post-operatively. And just to round it out with some of the cosmetic risks or complications of liposuction, extra skin. Anytime that we remove what is underneath the skin, we are still left with the container or the skin. Skin retraction after liposuction can take about 3 to 6 months, and we do always need to weigh the pros and cons of removing fat and maintaining skin quality. The amount of extra skin you have is dependent on age, genetic factors, skin quality, how well you've taken care of your skin up until this point. But we can always talk about what the options are. Some hospitals and in-office liposuction, we do have skin tightening devices available. And then there is always the discussion of, does the skin need to be removed? So extra skin is expected. If we are going to do liposuction to evacuate lipedema and then remove skin later, for example, it's important to keep in mind that while your body is healing, you will notice that extra skin, but always keep in mind that if we're coming back to cut the skin off later, it will get better. That look will get better. So that's a little bit about risks, side effects, complications from liposuction. Getting ready for surgery, we're going to discuss some of the medications that we commonly prescribe. This is for most patients, but not all, depending on allergies and intolerances. The first is an antibiotic by mouth. That is one of your mandatory medications. The one that we typically send is cefadroxil or Duracef. It is a 7 to 21 day course, depending on what we are lipoing and how much volume we plan to take out. Your second mandatory medication is going to be an antibiotic ointment. This is called muprysin or Bactroban, depending on if you have the generic or the name brand. That will go on all the lipo holes until they close up and the scabs fall off. It will also go on the drain incision sites starting day 2 post-op for both of those. So we've talked about the antibiotics. Now we're going to talk about some of the optional medications or medications that we might not prescribe for everybody. One of those is a blood thinner. So I talked earlier about risk of blood clot, DVT, and that we will individualize your risk assessment if you're going to be on a blood thinner. The blood thinners that we commonly prescribe are Lovenox or enoxaparin. And by mouth, we also have Eliquis as an option, but not everybody who needs chemoprophylaxis is a candidate for Eliquis. We also send Zofran for most of our patients. This is ondansetron if you're getting the generic, and that is an anti-nausea medicine. A lot of the times we can get nauseous when we take pain medicine, we can get nauseous from anesthesia, or even just being in pain can make us feel a little sick to our stomachs. So that's why we send Zofran for our patients. We typically send a narcotic that is called Norco. That's hydrocodone with Tylenol in it. Tylenol is also acetaminophen. There are lots of people who have never had a narcotic before in their life, so if that's you, you will probably get Norco. If you have and you didn't tolerate Norco, please let us know. We'll send you something different. This is for severe pain. We typically write for 20 tablets to start. It can only be sent within the state of Georgia. So a lot of our patients are out of the state, so keep in mind you will pick this up when you come for surgery, and it also cannot be sent back to your home state if you need a refill. Most of our patients are off the narcotic within 1 week. The less you take it, the better you do typically. It can cause constipation, brain fog, all this sorts of nasty side effects. It is definitely necessary to get the pain under control, but it's better to take over-the-counter or non-narcotic agents if possible. That brings me to my next topic, which is Celebrex. So Celebrex is an NSAID or a non-steroidal anti-inflammatory drug. It's the same drug class as Motrin, aka ibuprofen, Aleve, aka naproxen, and there are lots of other brands of NSAIDs out there, but those are kind of the top ones. If you can tolerate NSAIDs, we may prescribe Celebrex or celecoxib for you. It's a stronger version of ibuprofen, aka Motrin, or Aleve, aka naproxen. You would not take ibuprofen or naproxen if you are written for Celebrex and taking it. It can be great to get the pain under control, kind of baseline with the Celebrex, and then treat as needed with narcotic. So the Celebrex, it's typically pretty well tolerated. If you are getting a lot of burping, reflux, stuff like that, let us know, and we will probably just tell you to switch to Motrin because the Celebrex is a little too strong for your stomach lining. If you cannot take NSAIDs, this is not going to be an option for you. Typically, people who have had gastric bypass or any sort of weight loss surgery cannot take NSAIDs. If you're wondering if that's you, please reach out to your bariatric surgeon or your primary care. Sometimes people can be on a short course of them. All right, on the topic of medications, let's talk about what you need to stop before surgery. So pretty much all supplements should be stopped within 1 week of surgery. So you will not take them within 7 days before surgery, and you will not take them for 7 days after surgery. This is because we haven't really studied these drugs very well, supplements that is, and the FDA also doesn't have purview over it, so they aren't able to check and make sure what's in it and is it an appropriate dose. So we're not saying that supplements are bad, we're just saying that it's better to be safe than sorry and stop taking them 1 week before surgery. This especially counts for a couple: ginkgo, garlic, ginseng, St. John's wort. They all have drug interactions, but again, just don't take them for 1 week. Some supplements that are safe: arnica and bromelain, appropriate doses of calcium, zinc, vitamin C, and D. Those are all okay to take. And then you can also take iron, potassium, B12. We actually encourage iron, which I'll talk about again a little later in this segment. High blood pressure drugs or antihypertensives. These are valsartan, lisinopril, all sorts of drugs like that. If you're wondering if your drug is an antihypertension drug, please reach out to us and your primary care. Those cannot be taken within 24 hours of surgery. So typically you will take that the day before surgery, but not the day of surgery. Very important to avoid that as it can interact with anesthesia drugs. Things you can take the morning of surgery: any sort of depression medication, any sort of antipsychotic, any antispasmodic or something you take for seizures. Thyroid medications are okay to take the morning of surgery as well. Moving on to one of the bigger topics of what can I take before surgery: GLP-1s like Ozempic, tirzepatide, Zepbound, semaglutide, any sort of weight loss drug, or it's also a diabetes drug. Those cannot be taken within 7 days of surgery. So that is a full 7 days that you do not take it. If you have taken it within 3 months, you do need to follow the most current guidelines from anesthesia. As of today, which is March 2025, I'm going to talk to you about the guidelines for stopping GLP-1s and the day before surgery, etc. So no GLP-1 for 7 days pre-op, and then you also have to be on a clear liquid diet for 24 hours pre-operatively. So that is really intense guidelines from anesthesia. Please, please, please follow these instructions. Piedmont anesthesiologists are there to keep you safe. They are very highly trained, but they do not want to risk anything. They have no problem canceling a case if one of our patients has not followed instructions on the GLP-1 guidelines. So what is a clear liquid? Tea is fine, chicken broth is fine, Sprite, water, all that's fine. I would generally recommend looking into a colonoscopy clear liquid diet prep to see what you can eat or not eat, drink. No matter what, if you're on a GLP-1 or not, and regardless of your surgery start time, you cannot have anything to eat or drink after midnight the night before surgery. This is really, really pertinent. You can take small sips of water if you're going to take those medications I mentioned earlier that are okay to take the morning of, like thyroid medication, any sort of mood medication. Those are fine to take with tiny sips of water, but otherwise you cannot have anything in your mouth after midnight the day before surgery. Another drug that you can't have within 7 days is phentermine, which is a common weight loss or appetite suppressing drug. So keep in mind that that also counts for 7 days. There are lots of other drugs out there that we're not going to discuss here. We will talk about in your pre-op specifically that have different guidelines. I'm talking about like drugs for Crohn's disease or something like that. Like these are DMARDs is what they're called. If you are curious about your specific drug, please reach out to us individually, and we will have a 30-minute pre-op to discuss you and your specific surgery. Another thing it's okay to take before surgery, Tylenol is fine. So if that's your pain medicine of choice, great. We do ask that you avoid aspirin for 1 week before surgery and 1 week after. If you're on it for something regarding your heart, please reach out to us. Tylenol is actually okay after surgery as well. The maximum Tylenol dosage for adults is 3,000 milligrams in a 24-hour period. So I mentioned a little earlier, you might get Norco, which is a narcotic that has Tylenol in it. You cannot go over the maximum dosage of Tylenol if you're going to take additional Tylenol while you're taking Norco. So that's it for medications that we are going to send. There's always changes and differences based on patients, but just kind of giving you a roadmap for your liposuction surgery. Now I'm going to talk about some items you should buy in preparation for surgery. These are not necessary, but these are things that a lot of our patients have found helpful when they're recovering from liposuction. So the first one actually is necessary. I lied about that. It's Hibiclens. This is a pink antimicrobial soap. You can buy it at Walgreens, Amazon, CVS, and you will need to use that before surgery on the area that we're going to treat. Preferably you'll do this for about 3 to 5 nights before surgery, but if you forget, you absolutely must do it the night before surgery. Also before surgery, you cannot put on any lotions or perfumes, so the last thing on your body should be that Hibiclens in the shower before your surgery. Some other things that people find helpful to have are gloves, nitrile exam gloves, just like the ones that we wear here in the office, that will help you and your caregiver when you're putting on mupirocin, getting on and off compression, that kind of thing. You may also want to look into puppy pads or Chuck's pads. These are going to help with any sort of leaking from the lipo holes, etc. We do recommend most of our patients take an iron supplement. An over-the-counter iron supplement will be perfectly fine. One that we recommend is Slow FE or Slow Iron. If you are going to take this, please start 30 days before surgery and take it daily. Miralax is another thing that people have found helpful. As a provider, I recommend Miralax over most of the other stool softeners and agents to help with constipation. The longer that you're on a narcotic, the worse your constipation can get. So if you are taking the narcotic around the clock and you're also dealing with constipation, it may be helpful to cease or push out your dosing of that narcotic. Miralax twice a day post-op is really helpful to help get things moving in a safe way. Some other things that I would recommend, if you know you're going to have a drain or multiple drains, you can get a drain belt or drain holder. These are typically listed under mastectomy supplies, but it's just kind of like a little band that you can wear that will hold your drains. This will just make you feel a little more comfortable while you're putting on and off your drains. Some things you should get from the grocery store before your surgery, definitely look into some electrolyte-rich fluids. These could be liquid IV, LMNT, Gatorade, whichever one you're getting. Don't get the sugar-free version. If you are sensitive to sugars, you can cut it with water, but the sugar is kind of what helps your body recover faster. So we need sugar in our diet. We need carbohydrates. I would also make sure you're looking into some fiber-rich and some protein-rich foods. You may not be very hungry after general anesthesia, so the more you eat of good quality food, the better. So that's something that I would also look into getting at the grocery store when you're there. Finally, you might want to look into a waterproof mattress cover or possibly even a shower liner for some upholstery like in your car or your couch. This is especially true if you're going to be going straight home after surgery. You'll want to protect those surfaces from any leakage. You may have drains for liposuction. This is, again, as I've mentioned in a couple other sections of this video, dependent on how much lipo that we're gonna take out. It can also be dependent on where you live, how much extra skin you already have, and some other factors. We will talk to you individually if you will have lipo, but for example, when we do lipedema debulking surgery to the legs, we typically always put drains in because this surgery is just really prone to developing seromas. If you have drains, they will be stitched or sutured into your skin. That means unless there's a big hard yank on the drain, they are not going anywhere. You will keep the drains in until they are putting out the required criteria. And I'm gonna walk through that here. It's also in your printed post-op instructions. They have to individually be putting out less than 30 milliliters over a 24-hour period for 2 consecutive days. If you have more than one drain, you remove them one at a time, giving the remaining drain another 24 hours to possibly put out more than 30 milliliters and need to stay in. If you have 2 drains that are pretty close in output, pull the one that's putting out less first. So what that means when you have the drains in is that every couple hours, let's say 6 to 8, you will be emptying your drain. When they're inflated like a grenade, that's where you measure the output. It's little lines on there that tell you how much it is. And you'll write down, for example, 7 a.m., 25 milliliters. You'll squeeze them again like a potato chip, and that's gonna help pull the suction the best. Don't push them up in like a bell or like a little cake. It's just either grenade or squeezed in like a potato chip or like a C. Once a day, you should be stripping the drain tubing. So what that means is you will take part of the drain in one hand and use the other hand to pull, then move your hand and pull. We have a video that's also going to be up about drain care and showing you how to strip the drains and stuff like that. Again, super important that you are measuring the output when it comes out. When it comes time to remove it, you can use a tiny little scissor or even a clean nail clipper and a clean pair of tweezers. You will grab the suture that's attached to the skin and cut it close to the skin. You need to remove the entire suture from the skin and the drain. Shouldn't be too painful to remove. Most of the time when I remove them in clinic, people ask if it's done yet, and I already completed removing it. Every now and then there can be a little discomfort associated with it, but it's mostly the thought of taking them out that kind of scares our patients and makes them nervous than the actual action itself. So that's the kind of deal on drains. Let's talk about compression. Compression is paramount to your recovery from lipo as well as your results from liposuction. Not only does it help prevent seromas, but it also encourages the skin retraction and it helps prevent swelling and therefore decreases pain from swelling. Your compression needs to be one size smaller than what you currently measure. It can also work to try it on, and if it's too tight for you to wear, then that's going to be perfect for post-op. Some brands that we recommend are Mirena, Lipoelastic. Some brands that are okay are Cizalis and Juzo, but those tend to be really sticky and hard to get on and off. So our preferred brands here at the office are Mirena and Lipoelastic. You will need to wear your compression no matter what area we lipo for 22 hours a day for the 6 weeks directly post-op. Once you hit 6 weeks, you can drop down to 12 hours a day. If you're looking for strength or guidance on strength, it should be 20 to 30 millimeters mercury. If not, just make sure it is so tight that you cannot pull it away from your skin easily. If it's kind of like a yoga pant where you can grab the fabric, that's going to be way too loose for after surgery. Some questions that I get often: what style of compression should I get for leg and arm lipo? So for arm liposuction, it needs to come down to the wrist and it needs to clasp, zip, or button in the front. This is so that we can get it on you while you're still asleep. So don't look for the kind that can only be pulled over the head. For your leg compression, it needs to be full length from the ankle all the way up to the waistline. Ideally, it goes over the foot. Mirena does make a specific lipedema garment. That one's great if you're having leg liposuction for lipedema. Another thing I want to make sure you're aware of, if you have a discrepancy in size, I typically see this with the legs are smaller than the belly or the buttock region. If you get the style of compression that has girdles or snaps and hooks on the side, you can get what's called an extender, which can help it stay nice and fitted on the legs and give you enough room to breathe on your belly if that's the case. So lots of options here. If you're curious about your specific compression and if it's not listed in this video, you want to make sure it's good enough, please just reach out to us. Manual lymphatic drainage, or MLD, is an awesome thing to do post-op lipo, but it is not strictly necessary. If you're going to do it, you should start at 1 week post-op and do it around 1 to 3 times a week until you hit the 6-week post-op mark. It can help a lot with lymphatic flow, swelling, pain, but again, it's not entirely required. There are often some problems finding providers who are in network with insurance if you're going through insurance, or providers that are close by. If this is the case and you really want to do MLD, I encourage you to look up on YouTube self-MLD or teach your care partner how to do MLD on you. But again, that starts at 1 week post-op and continues for maximum benefit until the 6-week mark. Scars and wound care is the next section that I want to talk to you all about. You will have a couple scars from the lipo incisions as well as from where the drains were if you have drains. The scars will lighten up in color over about 18 to 24 months. It takes a long time to find the final color of your scars. The best thing that you can do to treat the scars once they're fully healed is silicone gel or silicone scar tape. You also need to prevent direct sunlight on the scars, so I recommend either a zinc sunscreen or a physical scar barrier. This can be clothing. There's also stickers out there. You can put them on your skin that are, SPF. So look into that if you're going to be in the sun after you've had liposuction. In the direct couple weeks post-op, what you need to do to the lipo incisions and the drain incision is apply mupirocin ointment once a day after showering. That's all you need to do. And once they form scabs and the scabs fall off, you can stop doing the mupirocin and switch to a moisturizer of your choice. Aquaphor is a great one. Once the scabs fall off, they are considered fully healed. All right, and to round it out, I want to talk about post-op expectations and restrictions after surgery. So post-operatively, you will expect a little bit of weakness, fatigue, lightheadedness, or dizziness. When this becomes a problem where you need to go to the emergency room or call us is if you are fainting or blacking out repeatedly. So if you can't get from, let's say, the couch to the bedroom, which is just usually a couple steps, that's when you need to let us know. That could be indicative of a bigger problem like dehydration, anemia from blood loss, or at worst, it could indicate some sort of PE or an issue with the lungs. So expect a little dizziness and lightheadedness, but when it's too much is when you are fainting and blacking out. That's when you need to reach out to us. My recommendations, other than increasing your fluids to more than what you normally drink, would be to change positions slowly, especially when it comes to your first shower post-op. So I recommend waiting until day 2 post-op to shower, just so that you can kind of get your bearings for how you're feeling, and then move slowly, taking your compression off and waiting a couple minutes until you are kind of used to this new blood pressure. The compression kind of artificially increases your blood pressure. After you've waited a couple minutes, then get into a cool shower, not a hot shower. I do recommend a shower chair or having your caregiver nearby who's ready to help you in case you start to feel woozy. The problem that I see is a lot of people just rip their compression off because they're so ready to take a shower day 2. They get into a hot shower, their blood vessels dilate, and they faint. So while this isn't a medical emergency most times, you can hit your head, and then now we've got something new we've got to worry about. And then restrictions, there is absolutely no exercise for 3 weeks post-op, no matter what kind of lipo you have. And then you cannot be submerged in water until the lipo hole scabs have fallen off on their own accord. So no swimming, no sitting in a bathtub until the lipo holes have closed and the scabs have fallen off. So that is the end of my video for liposuction pre-operative education and prep. Lots of things covered in this video. We will again have that 30-minute pre-op where just you and one of the practitioners or Dr. Hagopian discuss your surgery. But this is a great way to get some of those questions out of the way, and it may even bring up some new questions that you hadn't thought of. Thanks so much for watching, and we will see you for your pre-op.